What if there isn't one right way to do things, only many right ways? Have you ever noticed how strongly we defend our right way of doing something at work, at home, how we load the dishwasher, drive a car, or chart a patient note?
It's amazing how quickly my way becomes the right way. Could it be that what we call right is actually just our preference, shaped by our training, our family, or personality? And I want to shout out to my dad, who's a notorious follower of the My Way is the Right Way. And his favorite karaoke song to sing is, of course, My Way.
How much energy do we spend trying to convince other people that our way is simply the right way? What if we could soften and instead simply say, this is the way that works best for me? Thanks for joining us today at the Healing Medicine Podcast. Who are you listening to? I am Dr. Jessie Mahoney, and my co host is Dr. Ni-Cheng Liang. We are two board certified physicians who bring decades of experience to the conversation about wellness. If you crave more ease and aspire to rediscover your love for medicine and life, one mindful step at a time, you are in the right place. We hope you'll love today's episode, and if so, please share it. A reminder that nothing in our podcast is medical advice. Welcome to our episode From the Right Way to a Preference List, Finding Freedom and How You Work and Live. So today's topic is here because there is so much tension and exhaustion in medicine, and especially women in medicine and at work and at home, that comes from us trying to do things the right way. We're trained to believe that there is one right way to diagnose, chart, and do everything. It turns out that in coaching and in my own life, especially, I've learned that there are actually many right ways to do things. And when we can soften into the idea that there are many right ways, the world is a lot more spacious and calm. So, my hope in having this conversation today is that we all give ourselves permission to let go of control and perfectionism about whatever the right way is, and instead to show up with more curiosity and kindness for both ourselves and each other.
I love that this connects so deeply to mindfulness because really being aware of preferences is a mindful act. When we start noticing our own tendencies with compassion rather than judgment, and all of the different ways and preferences can be seen much more openly with our palms wide open, referencing back to a prior episode, as different options, as choices with mindfulness.
And to infuse a bit of humor here, this language of preferences came about because we had a nurse manager in my clinic who appreciated that every physician thought their way was the right way. And so when the medical assistants would float from working with one of us to another, there was always the right way. And they never knew what the right way was. And so we were asked to make something called a preference list. And so this idea that this is how I prefer to do it just is a much softer way to do it. And I also want to point out that just because something was on your preference list did not mean that it got done that way. And so it was kind of a nice way to just say, these are my preferences. And what I recognized recently is that that idea of a preference list also applies at home, and it applies in so many settings. So we wanted to talk about the myth of the right way. And we're ingrained so early that there is one right answer on a test, or one right procedure and protocol, or one right template. And this does help us in certain contexts. It creates routines and helps with patient safety and following evidence-based guidelines. But it doesn't apply in all settings. And one of the things I love to raise is sort of how can we be discerning about these default ways of thinking? When are they helpful and when are they not? When are they useful at work and not at home? And maybe in parts of your work and parts of your home?
And I live this every day in my clinical practice. The preference list that you mentioned shows up in our electronic medical record. And I was actually just recently tasked with working with other pulmonologists to come up with a order set basically to help work up interstitial lung disease patients. And so here we are, four different pulmonologists trying to work together on coming up with a standardized, uniform way to do this when really they were invitations for other pulmonologists in the same healthcare system to use the evidence that was available and put together in this order set to come up with a plan of figuring out what this interstitial lung disease was from. So it was like an invitation as opposed to like, you must work up your interstitial lung
Yeah.
disease patients this way. So the other aspects of preference lists and choosing or making note that this way is the right way is when we were taught in medical school how to communicate with our patients and also how to mentor trainees, how to train residents in essence.
Mhm.
But so often, many different approaches actually work just fine and very beautifully when we're allowed to have more flexibility, weaving in our own personalities, our own preferences, and ultimately being able to personalize our treatment plans for our patients who have really quite unique circumstances. Like my patient population is largely retired and on fixed incomes or have no income at all. And so I have to keep in mind transportation and financial insecurities, just to name a few of the different ways where the right way, quote unquote, really needs to become preferences and honestly what they can afford and what they're willing to prioritize on. So I spend a good portion of my day in the electronic medical record coming up with different inhaler regimens that a patient can actually afford. It might not be my preferred first line of choice, but I don't expect my patients to pay $600 a month when they're on fixed incomes for one inhaler. So there's a lot of flexibility and openness that has to go both ways between the patients, myself, insurance companies, and pharmaceutical companies ultimately to get patients on a plan that works for them.
Well, and in that case, the right way is the right way for the patient, right? But one of the things I think we hate the most in medicine is being told what the right way is. So this is the formulary option. And it's true that certain things are cheaper because of contracts and things like that. But I think it's part of the sort of injury and insult that we feel that we can't decide what works best or what would work best or choose what works best for a patient in a particular situation. So not only does their situation come into play, but at least in the places that I have practiced medicine, the formulary comes into play and you don't have a choice. This is what's on the formulary, and it will cost the patient a lot more money if you pick something else, whether it's their insurance or it's kind of a different way of approaching the drug situation. And I think it's very frustrating to us when we don't get to choose. We like to have choice.
No, absolutely.
And I think when we think there's only one right way, it also really impacts our ability to connect with others. And when I think about it at home, I'm thinking about co parenting with my husband, and I am the pediatrician. So my way is the right way to raise children. But it's not really. And I think so many women in medicine, I hear, we come at it from really good places that we want our children to thrive and do well, but we also want it done our way. And then we sort of discourage our partners from doing things, and then they don't help out. And what I have learned, I have a partner who does help out, but What I have learned when I have stepped back and let him do it his way, whatever way he thinks is the right way, that his way is often great. Sometimes it's even better than my way. And or, for certain kids, a different approach works better, or a certain situation, a different approach works better. And so honoring that there are lots of ways to do things that can all work out fine, but that when we lean into our way, we often end up burdened, exhausted, depleted, sometimes resentful and bitter because we're not getting help. Um, I think many people do this with their medical assistants or nurses. If they don't do a task just your way, then it's not good enough. So you have to do it. And then we wonder why we're not getting help. And so, this idea that we can allow space and creativity for other people to do things differently and maybe not perfectly, and whatever perfect is in our eyes, and that it can all turn out just as well and potentially even better.
And then there's circumstances where letting go of being right, like in quotations,
Mhm.
in clinical medicine can create more ease. And this comes up when I have to discharge patients from my clinic. It doesn't happen often, but unfortunately, when you're in practice long enough, you will come up with situations where you're going to have to discharge patients from your practice. And oftentimes there's a mismatch of expectations when they think that they have the right way and they want me to enact the right way according to them, when I don't think that what they think is the right way is actually right. So oftentimes it's not embedded in evidence-based medicine, it's more of a belief or what they've always done, for instance, related to a habitual thing that they would do when they would have an exacerbation, for instance. Uh, in this situation, when there's a disagreement about a treatment plan, rather than trying to impose my views on them and get into a pretty heated argument in a clinical setting, oftentimes I will simply say that I am informing you of the evidence based standard of care. And this is an invitation for you. It's up to you ultimately because you're the patient. I can prescribe, I can tell you what's out there in science, but if you don't choose to follow that, then that is your 100% human right to do so. And when there's kind of a fundamental disagreement, then I will oftentimes simply say, this is not a right fit. Like, I don't believe that I'm in a position at this point to be able to help you in the way that you would like to be helped. And it's better for both of us ultimately to go our separate ways. And so I've done a lot of work on this because there was a lot of people pleasing tendencies in the beginning of when I was a junior attending. But after being a pulmonologist for over 12 years now, I'm much quicker these days at being able to let go of being right and allow and accept a fundamental disagreement or a mistrust or a mismatch in expectations that leads to each of us going our separate ways.
Well, and right there is a beautiful point that you both think your way is the right way. And so it's very hard to work together when you have different right ways. And that sometimes it's better to work separately when you have different ways. And sometimes we cannot, like if you're co-parenting with someone. But even there, you can parent your way when you're with the kids, and they can parent their way when they're with the kids. But I think for people to honor that it's a different vision of what's right, because I think we take it personally when someone doesn't want to follow our directions. Somehow they don't respect us. And it's usually not about that. So preferences are come from our backgrounds, our families, our culture, our training, our temperament. And so I love this invitation of seeing preferences rather than right as not a threat or not like there's a problem, but that we just have lots of variety. And I think when we can shift from this idea of there isn't a right way, but this is to my preferred right way, then we have room for, all the colors. Like I think we often used to think there was a right way to dress, and what was right is no longer right. Or even things in medicine that we used to think are right, we now know are not right. So this just flexibility and fluidity is pretty cool. And I think this idea of thinking that there's a variety of ways to load the dishwasher, there's a variety of ways to fold the laundry or plan a vacation or make coffee, all the things. There's just lots of different ways that could all be equally valid and equally valuable.
It's quite freeing when you frame it that way, rather as like one way as the right way, and instead their preferences. Similar to multiple doors leading to compassion or multiple doors leading to mindfulness, there are lots of different ways to get to the same.
Multiple doors to clean dishes and clean clothes.
So there's a liberation
Mm,
in not limiting ourselves to one door.
yeah.
So we stop needing others to do things exactly like we do, whether that's with our patients, colleagues, partners, or our children. So I want to drop in a little bit of my own lived experience here, and I will just put a disclaimer out there. I love my parents. I absolutely do. I am so grateful for them. They live next door. They helped tremendously with childcare, and they helped me when I was going through cancer treatment. I don't always agree with the way that they do things, though. Like,
Does
for
anybody
instance,
agree with the way their parents do things?
exactly, right? So so for instance, seemingly trivial thing. Their washing machine is broken. My dad wants to try to get it repaired, but my mom would just like to buy a new one. She thinks that the repair cost is not going to be worth it and would just like to have a functional machine and probably like a functional and new washing machine. But rather than have a conversation about their disagreement, my mom wants to circumvent the conflict and get me involved
Of course she does.
and use
Of
me
course she
as,
does.
I don't know, the intermediary time and time again, not just about a broken washing machine. And I honor her preference. I acknowledge it, but I also honor my own boundaries and preferences even more by not wanting to get involved with their household stuff and decline
Mhm.
the invitation for me to be involved with their washing machine situation. I, of course, offer my own washing machine for their use if they need to wash their clothes as they're figuring this out amongst themselves.
That is entertaining. There's no right way to solve a broken washing machine. And I think that also our parents, they're bringing their own background and their own childhoods as to what's the right way. And what was the right way when they were raising their kids. We now have different ideas of what's the right way. And by the way, all the kids grew up and turned out fine. But I think we sometimes lean into, we know more now, or what we do now is better, but we don't actually know that uh, at this point. So when we drop the need to be right, as you mentioned, we get this liberation and freedom. We get flexibility. We get the ability to connect with people and learn stuff. And it can even be funny. I will like to say, like, sometimes you can do something someone else's right way. And even if it turns out badly, it can be funny. It doesn't, we tend to catastrophize and make it this terrible thing, but it doesn't have to be.
Mindfulness can absolutely help here. So, noticing when we're uncomfortable with some uncomfortable body sensations or uncomfortable emotions, such as tightness in the chest or the abdomen, or an irritation and annoyance, and asking ourselves, could this just be a preference that's arising?
Yeah. And so if it's just a preference, then there's no conflict. It's just intrigue, perhaps. And so when we can just be curious, that opens up everything, literally. Curious in a helpful way. We often talk about good questions and check questions that make things harder. And so saying, what can I learn from this? Or I like this way, and it's okay if someone else likes it the other way. And I want to bring to light here that part of the idea of this right and wrong is that there's one right way, which is our scarcity mindset coming into play. There's only one right way, but there could be tons of right ways. And then the catastrophizing I also just mentioned. So if there's one right way, if you don't do it that way, you're doing it the wrong way, and the wrong way leads to mistakes and bad outcomes, and we go down the path of catastrophizing. So this is why in people who are trained in medicine really have a sensitivity to this.
So let's bring in some medicine through this lens. I see this so clearly in how teams function when we assume variation equals wrongness, there can be a tension. But when we see it as diversity, there can be inclusivity and belonging.
There can also be research, right? If we do things different ways, we get information. It's an experiment, there's feedback. So variation can be a form of research, and it can be diversity can be a strength. And in fact, trying these different things is really how innovation happens. And yet we close ourselves off by having to do things the right way.
So, bringing up an example in clinical practice that recently happened is lung cancer screening guidelines. So, there have been an accepted guideline algorithm to follow depending on the sizes of nodules and also what constitutes high risk patients. But some of my colleagues have more recently been also adding on a lab for higher risk patients to check for inflammatory biomarkers and antigens that have been associated with higher risks of lung cancer to help further stratify lung nodules that are 8 millimeters or nodule or larger. And I used to be against this because the formal guidelines have not included this set of labs yet. And so to me, I was like, oh, well, that's wrong. But actually, when I open up to curiosity and learning more about this particular set of labs, I did try it on one of my patients where there was some ambiguity in the lung nodule, and it actually provides some really helpful information in terms of a branch point as to whether or not a biopsy should happen or if there can be more watchful waiting and repeat testing in a couple of months. So I think that when you're open to that in medicine, it can lead to even more options in your care plan. It also helps to increase your confidence in your decisions, your clinical decisions, and you can present this together with your patients as well.
So preferences instead of the right way also help us stay out of judgment, which is our tendency. We want to judge their way versus our way. And they also keep us out of this comparison as to one way is better or the worse. If they're just preferences, it allows us to really lean into what matters most to us as well. And so thinking about which way is going to help me do things in an aligned way or an authentic way. And so asking different questions rather than better or worse. If we have preferences, it's just what's the aligned way for me to do it? What feels right for me? And that gets back into the space where we tend to not trust ourselves. So we're looking for the right way always outside of ourselves when dropping into what you know and what you can trust from yourself can be a much more powerful way to move forward. So, recognizing that there are many right ways is also a form of self compassion. It gets us out of the shoulds, have tos, need tos, supposed to. Um, there are just options or choices or paths to to somewhere. And so you'll notice that we've actually run through a whole lot of things that this run right way brings up, a lot of the thought patterns that keep us stuck in medicine and in life. And so self-compassion is always something that we bring into it as a way to move forward.
And when you live with the intention to notice preferences as they arise, it can create harmony in relationships because we stop fighting over who's right. We get out of ego mindset and we can start grounding into curiosity and deep listening, which are very foundational facets of mindfulness.
And so seeing things as preferences is simply a practice of mindfulness. We've just sort of been building evidence and a case for it over this podcast. And so recognizing that when we show up mindfully and with preferences rather than right ways, there is much more peace and opportunity and different paths forward. So, as always, we want to end with a few reflection questions. And where in your life do you feel attached to doing things the right way?
How might it feel to see your right way as simply your preference?
Whose preferences might you be dismissing at work or at home?
What would it look like to honor your own preferences without needing others to agree?
And how might this bring more ease into your relationships and your work? So there are many, many right ways to do almost everything. And when we let go of the need to be right, we gain the freedom to be curious, kind, compassionate, connected, and collaborative.
Seeing our way as a preference and others' ways as equally valid helps us connect more deeply and lead more compassionately.
And if you want help shifting your thoughts about the right way and leaning into preferences, or with any other topics that we bring up here in the podcast, I would love to have you join me for a coaching retreat or coaching virtually. I will say at this time of the year, if you want CME, you pretty much have to do virtual coaching one on one to get it done by the end of the year. But there are lots of opportunities for next year, and planning ahead is wise and thoughtful and kind. And both Nicheng and I do speaking and workshops on a lot of these topics. And wouldn't it be fun to have a grand rounds about the right way versus preferences and really shifting people's thoughts on this? It would be a really powerful experience for both teams and institutions. So we would love to have you reach out if you would like to bring a more mindful approach to preferences and right ways and wrong ways to your institution, knowing that that's the path to more connection and compassionate care. We will see you next week.
Thanks for listening. If our message resonates, we'd love to connect further. Join us for coaching, mindfulness experiences, workshops, and retreats. Invite us to speak at your institution or conference. When you work with us, you don't just consume information, you create real change. Find me Chang Liang at Awakened Breath and Jessie Mahoney at Pause and Presence. Welcome to this mindful moment offering. If it's safe for you to do so, inviting you to close your eyes or lower your gaze a few inches in front of you. Start by noticing the points of contact between you and the surrounding environment. Noticing whatever is supporting you, from the ground to a chair, a cushion. And I'll invite you to join me in some mindful breathing practices. These practices can be used at any point in time should there be any discomfort, anxiety, stress, even pain. So the first one is called pursed lip breathing. What you'll do is inhale through the nose, filling up and then blowing out birthday candles, dragging that exhale breath 2 to 4 times longer than the inhale. We'll do that one more time. In through the nose and out through the mouth. One last time together, in through the nose and out through the mouth. Now, there's an alternate breath called the 4-7-8 breath that was made popular by the grandfather of integrative medicine, Dr. Andrew Weil. He was influenced by traditional yogic pranayama breathing for this 4-7-8 breath. So this also can be used when you are experiencing any discomfort. So you'll inhale through your nose for 4, 2, 3, 4, and then hold your breath for 7, 2, 3, 4, 5, 6, 7, and exhale out through your mouth. 2, 3, 4, 5, 6, 7, 8. We'll do that one more time together. Inhaling through your nose for 4, 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. And then exhaling 2, 3, 4, 5, 6, 7, 8. So these are 2 different breathwork options for you to try in moments of distress. I don't recommend doing more than 3 to 5 breath cycles, as sometimes you can actually breathe down your CO2 and actually cause some lightheadedness. So try 3 to 5 breath cycles and see what you notice. The latter 4-7-8 breath, I would not recommend for anyone with any chronic lung disease. I hope you'll take some moments to try some mindful breathing. Thanks so much for practicing with me.